name Sevaro comes from the word Sevaro, which are Sanskrit words that mean selfless service. Basically, that means to do good for others without expecting anything in return. We came up with that name because that's really the core, the essence, and philosophy of how we operate our entire company. That's how we view every patient, every partner, and every employee.
It's very unique in the system of healthcare. It's part tech company and part healthcare company, all rolled up into one.
I joined about 2 years ago. One of my good friends at a previous company I worked at referred me to Sevaro. And once I heard the story of using technology to help patients, what that patient pathway looks like and how integrated we are in patients' everyday lives and saving lives, I knew this was a place that I wanted to be long-term.
There's a limited number of neurologists, especially in stroke, around the country. And hospitals, health systems, and communities are facing a problem where they want to provide care to these patients. These patients are now having more complex, more common neurological disorders. And the future of neurological care really sits between in-person, wonderful boots on the ground neurologists in their communities, along with support from high quality virtual neurologists.
Synapse AI is a one-stop telehealth platform built by neurologists for neurologists. The platform is capable of electronic health record for our physicians to utilize. It also gives us valuable access to quality data that hospitals and healthcare systems can use to better promote the care of their patients.
So what we're able to do is mimic everything that happens in a hospital EMR on our own platform in a way that's super easy, user-friendly, intuitive. They really can see the entire patient pathway at a single glance.
I think the tech is a tool that's a living tool that we all work to perfect on a daily basis. And I think other providers, as they're using it, are going to realize it saves time, reduces errors, and probably is a quality control piece that's missing in a lot of settings.
I'm able to work with almost 100 neurologists seamlessly via telehealth platform that we've built from the ground up, interfacing with hospitals that truly have a neurologist shortage.
I had the opportunity to meet Dr. Narula for the first time. I was very familiar with virtual neurology. I've been in the space from a quality perspective for a few years. I understood the model very well, and having conversations with him and learning what he was trying to do and how he was trying to create a model that was going to be different, improve the quality of care that was provided, and eliminate that sporadic care model, it really inspired me to be a part of something that's going to be bigger and provide better care to our patients.
As a registered nurse and someone who's had over 6 years of experience in AI and tech growth, I firsthand witnessed the clunkiness that can follow telehealth. And what's unique about Sevaro is, number one, that it's run by physicians and clinical leaders who totally understand the barriers and provide the support. But it also has a technology as its key differentiator that sits in the background and assists through the whole process.
So I discovered Sevaro because they were the teleneurology provider at my hospital in my hometown, and saw the transformation in care at our hospital, how we were able to keep stroke patients in our community. We did not need to transfer them to higher level of care. And Sevaro actually holds our hospital record door to needle of 19 minutes.
We can have tech tools and infrastructure and business support, but at the end of the day, our product is our people. And I think we are good people who are very capable, who adapt to a variety of different situations to help our hospital partners respond to different kinds of challenges. And I think that's the foundation of any virtual services offering, is you have to have great people at the core.
Every day we are making a huge impact on many patients' lives. So by utilizing the technology, building, helping to innovate, to create, spreading this across the country as far as we can go, impacting patients' life at the end of the day is the most important thing.
Your workday is never going to be boring. As long as you're creative and having new ideas, they're going to get supported here. You can have an idea, you can water it, watch it grow, watch it expand, no matter what your job title is.
I choose to show up to Sevaro every day because of the community of people that I get to work with and the patients' lives that I get to impact. Everyone's core focus is always patient first.
I think in healthcare, it's really common to get burnt out or feel stuck or feel like you're not heard. You can grow on your own, but they'll also support your life outside of work, because you do make close connections with people here at Sevaro.
These are now strangers that never knew each other before from different parts of the country, who through our company, through Sevaro, are now connected and have formed meaningful relationships with each other.
Dr. Narula is wonderful and super infectious. Anybody who meets him immediately just feels his passion and his connection, and he always wants to stay in touch with the patients first.
Raj is a physician. He treats patients every day. He has experience in it, the struggles, the barriers, the blockers in healthcare. And what he's built with the Sevaro team and what we're continuing to build and grow upon is fixing the problems that physicians and healthcare providers have in treating patients so that it's easier and better for them.
Because of Sevaro, every hospital in the country has the access to a world-class neurologist to take care of their stroke patients or their neurological crises.
We all know healthcare should be better and it can be better. And if we don't do this, we don't know who else will.